Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Dr. Ockene, the topic of fasting versus not fasting before cholesterol testing is in the news again. What is your opinion?
You know, fasting for cholesterol testing is kind of like talking about fasting for blood sugar. And I think everybody understands that there's value in getting a fasting blood sugar and there's value in getting a non-fasting blood sugar because it shows what happens to your blood sugar when you're not fasting. And actually the same is probably true for cholesterol. But just to address it more directly, when you talk about cholesterol, you're really talking about a lipid profile, which includes a number of parameters. It includes total cholesterol, LDL, what people like to think of as the bad cholesterol, though it's not really bad, HDL, the so-called good cholesterol, and triglycerides, which is really kind of fat floating around in your blood. And it turns out that the only one that needs to be measured fasting is triglycerides. Total cholesterol, HDL move slowly with changes in diet. So it really doesn't matter. So, you know, what I tell doctors who ask that question is, look, you know, there's no problem getting a non-fasting total cholesterol and the whole rest of the lipid profile. And if with that the triglycerides are normal, then it's normal, you know, and there's no problem. If the triglycerides are high, then it's reasonable to repeat it in the fasting state.
Can you explain what triglycerides are?
Triglycerides are what fat is converted to as it crosses from the intestines into your bloodstream. Because fat by itself in the bloodstream would form big globules like oil and water and would clog everything. So that wouldn't work. So the body instantly combines it with protein, and that fat-protein combination is triglycerides.
What circumstances would lead someone to fast before cholesterol testing?
When you eat fat, fat and blood don't mix. Okay, if fat came into the bloodstream as pure fat, it would clog everything. So it's always immediately combined with a protein into what's called a lipoprotein. And the first of those is triglycerides. So triglycerides are very, very sensitive to what you ate last. Very sensitive to alcohol, very sensitive to saturated fat, very sensitive to simple sugars, like what people put in coffee. If that's the case, then as I follow people like that, it's very useful that they come in fasting. But for the majority of people, it's not necessary.
What information does a cholesterol test provide a doctor?
I am going to give you the businessman's viewpoint of what the lipid profiles are all about. And business people like to talk about just-in-time delivery systems. A just-in-time delivery system means that you want the brakes delivered the day before you put them in the car, because keeping a warehouse full of brakes is very expensive. And businesses figured that out about 30 years ago. The human body figured that out about 1 billion years ago, or maybe not quite that long, but millions of years ago. Because think of the cells of the body as little businesses. And they need cholesterol. Cholesterol is not an evil substance. Cholesterol is one of the body's vital building blocks. It's part of every cell membrane. It's part of every hormone. It's crucial. But the cells have no space for extra, and they don't know what to do with it, okay? When you eat fat, fat is turned into triglycerides, which I've already mentioned, and triglycerides are taken to the liver, which is the body's big chemical factory, and the liver takes triglycerides and rips them apart and repackages cholesterol to delivery, for delivery to the cells. And I think of it as the cholesterol, which is now the cholesterol, goes out to the cells in what I think of as little FedEx trucks labeled LDL, the so-called bad cholesterol. It's not bad cholesterol, it's the delivery truck. And the little FedEx truck that says LDL on the side of it comes up on the roads, which are your arteries, of course, and comes to the cells and says, hey, we got cholesterol for you. And if it's what the cells ordered, everybody's happy. That probably relates to a total cholesterol of about 130, which few Americans have, but is what primitive people used to have. If it's more than that, then the little dude that runs the cell business says, hey, I didn't order this stuff, and I don't have any place to put it. And the FedEx guy says, what do you want me to do with it? And the little cell dude says, dump it at the curb. And it gets dumped at the curb. If it keeps getting dumped at the curb, eventually the street gets clogged and nothing gets through. that's called a heart attack or a stroke. HDL, the so-called good cholesterol, is in fact the recycling truck. Roams around the arteries looking for stuff at the curb, picks it up, takes it back to the liver for reprocessing, recycling, if you will. And that kind of cutesy analogy is fairly accurate. Technically, HDL, the so-called good cholesterol, is called the reverse transport system. Same thing, picks up stuff at the curb, takes it back to the liver. So the ideal situation is to have a very high level of the good cholesterol, of HDL, and a very low level of LDL, and then everybody's happy. The people I see who get into the most trouble are people with low HDLs. We tend to focus on LDL because we've got great drugs to lower it, and there's not much we can do about HDL. But low HDLs are a marker for trouble. And it tends to go along with diabetes, and strong family histories and so on. So what you learn from the whole lipid profile is a lot. And the total cholesterol itself is almost not even useful because the total cholesterol is a composite of good and bad. So I see people who are sent to me because the doc's very concerned because they have a very high total cholesterol, 300 say. They have no other risk factors. They don't smoke, they're not diabetic, they don't have high blood pressure, and they have a high HDL. A high HDL is a protective thing. Even though it increases the total cholesterol, it's a good thing. So those are the things you learn from a lipid profile. Now, in terms of fasting or not fasting, if I have a patient with high triglycerides, I'll give you an example. I had one patient whose normal triglycerides are up to 150. I had one patient whose triglycerides were 800. His triglycerides fell 500 points when he gave up coffee. Now, there's absolutely nothing wrong with coffee. He was having a Dunkin' Donuts medium light twice a day. A medium light contains a quarter cup of cream. So he was having, when he thought he was having coffee, was in fact having a half a pint of cream every day in his coffee, and God knows how much sugar. Just cutting that out made his triglycerides plummet. So following that kind of thing, there it's useful to get fasting data.
How often should people have their cholesterol tested?
That's a function of what the need is. So average person, once a year. If it's just screening, if it's a young person, maybe once every 5 years, and it was normal. So it's a function of age and other disease. On the other hand, somebody with known coronary disease, where I want their LDL to be under 70, I may be following them every 3 months.
Would there be a notable difference in the test results if someone fasted versus if they didn't fast?
If the triglycerides are an issue, yes. If the triglycerides are not an issue, no.